President Trump has said the US states of Texas and Vermont will allow certain businesses to reopen from Monday. At the daily White House briefing, Mr. Trump said there were signs that the virus had passed its peak. In major cities around the country, demonstrators have been demanding an end to the stay-at-home orders. Professor Brahma Mukherjee, who is Professor of Global Health and Epidemiology at the University of Michigan, said the US would have to be careful as it eased the lockdown.
I want to filter out the political biases and agenda from the scientific conversation. So what I'm interested in is working with my colleagues in economics and policy to come back with an optimal route to come back to normal. And the fact is we just have slowed down in our case counts. We have not turned the corner in many places, and there are new peaks coming out. So it would be quite short-sighted to open in a hasty way and really undo the social distancing work that all of us have done together. And humans are finally ultimately beating the dire model projections. So we have to be really careful as we reopen. So I think we have to go through a step of stabilization and then reactivating the workforce. So that's my own opinion, that it's not the question of the number of case counts or time, but we have to look around and say that are we ready to follow the three principles of test, trace, and treat, and then work on the viral control and the economic recovery simultaneously.
Professor Brahma Mukherjee speaking to me a little earlier. South Korea has reported only 8 new coronavirus cases in the last 24 hours. It's the first time in 2 months that the country has seen only a single-digit increase in infections. As our correspondent Laura Bicker reports, the authorities in Seoul have now announced that they plan to ease restrictions on social gatherings.
Right from the very first case, which was January the 20th. Remember, that's the same day as the United States announced its first case of coronavirus. The difference here was that within 17 days, this country had created a test and 100 laboratories ready to process those tests. Right from the outset, they decided to go after this virus aggressively. And way back at the end of February, when I was in the worst hit area of Daegu, and there were around 100 ambulances lining outside the hospital, I said to officials, "Are you ever going to get this under control?" They said to me at the time, "Yes, we are determined." And now, just 8 weeks later, here we are, and they have now announced 8 new cases. The last 6 days, it's all been under 20 daily new cases. And it's worth mentioning, Rita, that 5 of those 8 new cases today come from overseas arrivals, where they're testing everyone at the airport and also demanding that everyone arriving undergo 14 days quarantine.
And what was it in South Korea that gave them this efficiency and determination? Had it been previous experience? And South Korea had been exposed to SARS, hadn't it?
Yeah, so it's not just SARS, it was MERS, it was Middle East Respiratory Syndrome back in 2015. South Korea had the worst outbreak outside of the Middle East. And at that time, they realised that they couldn't trace where patient 0 had come from and where he had travelled to. And at that point, they recreated laws to try to track and trace those with the infection. So it means that right now, the government can, if I had coronavirus, the government would track me using my phone. I would also be required to fill in details of how I was feeling each day. The minute that I went outside my quarantine area, the phone would ring. So that's the kind of tracking and tracing measures they were used. Also at the time, I've been told that the day that the first patient was diagnosed, they started to realise how contagious this virus was. So they realised they needed a test, and they needed a test quickly. They told 4 laboratories that they needed a test, and they had this kind of partnership between private and public health, which allowed 1 laboratory to come up with a test within a week. 4 others came up with other tests. So that's how they've managed to do it quite quickly. Experience, and also this kind of public-private partnership, which has allowed infectious disease specialists to come to the forefront.
The BBC's Laura Bicker there.